Be EMS training night for Monday because of our social distancing, so we got together, thought we would put together a short training video for all responding EMTs and firefighters. I want to cover PPE and a decon of the ambulance.
Some of the stuff that we're going to go over is just covering what you are going to be wearing for PPE for patients that are asymptomatic or symptomatic. All calls will be treated as if a patient is asymptomatic. Please make sure you are wearing the proper PPE. If you are not, we could get in a lot of trouble for not wearing it. We're gonna go over some goggles or glasses. If you are going to wear your regular reading glasses, or if you have prescription glasses, try and wear goggles instead of these so that you can still see. You have your N95s. Your N95s are disposable. When you are wearing an N95, please try to make sure that you are grabbing from the straps. You are not grabbing the front of it or the sides of it due to the possible contamination. Your gloves are as well as disposable, as everybody should know. Please make sure after every contact you come in with a patient or anything you are doing, you remove your gloves, use hand sanitizer, or wash your hands if necessary or possible, and then reapply a new pair of gloves. Your gown is disposable. The bags of gowns like these are disposable, not what I'm going to show you next. Try to use these as a one-time use. If they are not damaged, ask somebody. Sometimes they can be reused depending on the situation. We have ponchos that you can use as another kind of gown. Use these as a last resort though, just because they're not skin tight. Doug, would you like to go over these?
Sure. So, because of the shortage of gowns, we went out and purchased a couple sizes of these rain suits. These are not throwaway. Please decon them if possible. It's just another level of protection. We also have the face shield. You want to make sure you have that on also. These are also not throwaways. Wipe them down when we're done. As far as all the PPE, this will all be on 7 and 8. Mainly on 8 because that's going to be the main responding vehicle. With that said, I'll just go over a new SOG that the chief has put out. This is a temporary SOG, effective immediately until further notice. Everyone is to respond to the hall for all calls except 501, 502, and 504. For all EMS, only one EMT will be going in to assist the patient. That EMT will have an N95, gloves, goggles, safety glasses, all the proper PPE, with a radio for communication. All responders will wait outside the fire company vehicle they respond in until called upon by the officer in charge. Any responder comes within 6 feet of the patient, stating if you're called in for lift assist or EMT treating the patient needs help with anything, that you will don full PPE before you enter the house. We are limiting the crew to one EMT and driver only for the transport. If there's a medical emergency needed for other EMTs, that other EMT can ride. Example, severe trauma, potential for CPR, etc. It's recommended that the driver at least wear an N95. We do have the cab sealed off in the rig. I guess it's at their own discretion. If it impedes their sight of driving, obviously we don't want them to wear it, or impedes their breathing. So the driver, just try not to make any contact and stay in the vehicle and with the vents. running on high, circulate the air, maybe roll the windows down. Before returning to the hall, there will be a gross decon at the hospital, and make sure you're most of all, taking care of yourself. Just be smart, don't take your mask off, don't take your gloves off until after you've deconned everything. There will be trash bags, the black trash bags in the rig to get rid of all your gowns and everything that you feel needs to be disposed of. Paper towels. The next segment of this video will be going over the decon of the ambulance to give you a little more insight on that.
Just a couple of things I'd like to throw out there. When you are getting back from a call, like where a person is sick, any medical call, any call in general, when you go home, take your clothes off and take a shower. Trying to stay clean is one of the biggest things that will help you prevent the spread to your family, to yourself. And with all the training, make sure you're taking your gloves off properly. It's trying to stay clean. Make sure you are trying to stay as clean as possible. Any other things?
No, we'll move on to the decon.
Okay, we'll see you in the next segment.
Okay, part 2, decon in the ambulance. This is a pretty important step also in the control of this virus. We will demonstrate as we go. Macy, my assistant, will be going through the cleaning operation, and I will try to narrate. Action.
All right, everybody, so I'm going to show you how to properly clean the ambulance and the stretcher. Please make sure when you are going to clean the ambulance and stretcher, you take your gown off. You can change your gloves. Obviously, I would want you to change your gloves, but keep your mask on and your shield on. When you're cleaning it down, spray it down so that the whole thing is pretty much saturated. And you take your paper towel and make sure you get every inch on the stretcher. If you are for whatever reason using bleach, try to make sure you are not going to get it on your clothes, because it will turn your clothes a different color. Once you do the bed part itself, take the spray your paper towel, and wipe down each strap. Now I will show you that you need to wipe down the wings of the stretcher. Anywhere the patient would possibly touch, assume is contaminated. So you want to make sure you wipe down the back and the front of the wing. And then you also make sure that you wipe down the handles that where you are touching. I like to wipe down the IV pole just because anything can touch that. And I also like to wipe down the oxygen regulator. That's all.
Action.
So now I'm going to be showing you how to properly wipe down the back of the ambulance for deconning, and as well as mop the floor.
Thank you all for watching this video. I hope it helps. There's some good information in there for you. Please take this very serious. It's up to us to keep this from spreading. Have any questions, you can contact myself or Nick. Have a good day.